If we're going to discuss orthopedic problems, the hand has to be included because it's a very common site for problem of patients having arthritis and or just recurrent injuries. The hand itself, of course, has the 5 digits, and the median nerve, which goes down the volar side of the arm, commonly can be compressed by the tight band on the volar side of the arm, the palm side. It acts like an under-surface watch band, and with activities, repetitive, injury, swelling, such as an arthritis, that nerve will be compressed. The distribution of the sensation to the fingers will be diminished. Numbness, tingling. So to fix that, we make an incision, approximately a 1/2 inch, and one in the palm, a 1/4 inch, and under the skin pass a guide in order to release the band of the palmar fascia. It's an easy fix. It takes approximately less than 5 minutes. It's endoscopic, meaning done minimally invasive. The patient wears a dressing for approximately a day or 2 and go back to normal activities within 2 to 4 days. Rehabilitation, usually, most of the time, is not necessary. In addition to that, trigger fingers of the hand, locking the finger, is released in a similar fashion of a band at the finger. Index, long, ring, small, maybe occasionally the thumb. Another common problem with the hand is aquarius tendonitis when movement of the wrist for repetitive activities such as a hairdresser, a carpenter. This tendon, affecting the wrist extensor tendons, becomes extremely involved to the base of the thumb. That tendon can be released in a similar fashion. There are compression syndromes for overuse. And the last common one is Dupuytren's disease, where the fingers curl and contract, usually in older people, and they contract so they can't move their fingers, and that requires injections and or surgical release. Those are the common problems of the hand, which we treat all the time because people have to have that hand, particularly a right-handed person with any of these conditions, come in pretty quickly because they can't stand it. They can't open a car door, they can't comb their hair. Dexterity just goes out the window. So we think of these problems frequently, but how they are treated generally is minimally invasive, very quick recovery of all of these conditions, generally less than that of 2 weeks, and most people can turn to 80% to 90% normal.